heart murmur, an unusual, whooshing heart sound that may be innocent or may reflect disease or malformation. The heart murmur is created by blood flow through the heart valve, by blood flow through a narrow chamber, or by an unusual connection between the chambers, is seen with congenital heart disease. Sometimes the heart murmur does not represent any disease or condition and is, therefore, referred to as a functional heart murmur. There are many forms of heart murmurs representing the variety of heart conditions. Each type of murmur is characterized by its location, timing, duration, as well as the intensity and quality of the sound it makes. The heart murmur is usually heard by a physician while he or she listens to the chest with a stethoscope. While the heart murmur itself is never treated, sometimes the condition it represents may require treatment.